Okay, I want you to stitch this and tell me about a time that you were medically gaslighted.
So I actually have quite a few stories for this one. Before I was diagnosed with EDS, my primary care doctor at the time told me that EDS was too rare and that anything that was named after someone, he didn't have to know. And then even after coming back from the Mayo Clinic being diagnosed by two doctors, two specialists, including a geneticist, he still didn't really believe it. Before I was diagnosed with POTS, that same doctor told me that I did not have POTS and I just had anxiety, and that was the reason for my high heart rate. I then had a tilt table test done. I've actually had 3 done. And the first one I had done, I passed out within 3 minutes and was diagnosed with POTS and neurocardiogenic syncope. And after having about 3 years of GI issues, what I thought was gastroparesis, I was diagnosed with median arcuate ligament syndrome. It's also called MALS for short. And MALS is basically where there's an artery that runs to your stomach and small intestines is being compressed by the ligament, and so there's a lack of blood flow getting to your stomach and small intestines. I had severe pain for about 3 years and was told that there was nothing wrong with me. I then had surgery for MALS, which failed. And the worst part is that I was told by the surgeon that if we would have caught it earlier, that it could have saved me from having gastroparesis and small bowel obstruction or small bowel paralysis. And now, because of that, I am completely reliant on a feeding tube in order for me to get nutrition and to help with my severe pain that I have. And this last one is probably the worst one. I was born with autoimmune hepatitis, so it's an autoimmune liver disease. And I was diagnosed with that around 13. After having this for my entire life, I was told last year that I will be needing a liver transplant. And this is all because my previous liver doctor didn't do his due diligence and increase one medication that I should have been taking a higher dose of. After coming to that doctor and telling him that, he completely gaslit me and told me that I didn't need a liver transplant. And so because of this, I will be in my mid-20s needing a liver transplant. So learn from me, speak up for yourself, and use your voice, please. And don't allow yourself to be gaslit by medical professionals.